RT World's health correspondent Nicola joins us from London to help answer that question. And Nicola, Trump touted this treatment as a breakthrough, but it really isn't, is it? Can you explain to us first what it is?
Yeah, you're right straight away there, Rachel, that it's not a breakthrough. But how it works is if somebody has Covid-19, as we've probably been talking about for quite some time, they'll create antibodies against it. And what doctors can do is 2 or 3 weeks later, they can harvest these antibodies from somebody's blood, from the plasma in their blood. Then they can check it's safe, they can purify it, and then basically, like giving a blood transfusion, they can infuse it in somebody who's in hospital, who has severe Covid-19 and whose own immune system isn't working effectively. And the idea is that by having these antibodies transfused into that person, it will kickstart their body to create antibodies and treat them. And there have been some results showing that this is effective. But it's not new. It used to be called anti-serum therapy. And Rachel, you won't believe this, but it actually first of all started with goats and horses being injected with diphtheria or tetanus toxins, and then the serum being taken from them and given to humans to treat them for either diphtheria or tetanus. And in fact, the man who developed this in the late 1800s went on to win the very first Nobel Prize for medicine because of this.
Mm-hmm. So, Nicola, Trump says that this treatment could reduce deaths by 35%. I mean, but do we really know that? Do we have enough evidence to show how effective this treatment actually is?
Yeah, the short answer to that, Rachel, is actually no. Now, it has been used by doctors worldwide as part of clinical trials, including in Turkey, including here in the UK. There's been a lot of published and unpublished research talking about it, but what there hasn't been is enough randomised controlled trials. And of course, this is where you're comparing somebody who's only given the plasma therapy with somebody who doesn't get the plasma therapy. And what's actually been happening is all the people who've been getting this convalescent plasma therapy have also been having other treatments. They might have been getting dexamethasone, the steroid that we know is effective. So you can't actually tell whether, at the moment you can't tell whether it's the convalescent plasma therapy that's working or the other treatments. And that's why President Trump's decision is actually garnering quite a lot of criticism. Certainly one of the doctors here in the UK, who's an associate professor of medicine at Leeds University, says this decision shows that what happened with hydroxychloroquine, the lessons there haven't been learned. And there is criticism that they're making this an emergency use authorisation at the moment when they don't as yet know definitely that it is the plasma therapy that's effective, or whether these other treatments are having a very, very major part in someone's recovery. There has been a small study from the Mayo Clinic saying that if it's given to hospitalised patients within the first 3 days, the chances of somebody dying are shortened. But as I said, they don't know yet whether it's just the plasma therapy or whether it's the other treatments they've been given.
All right, so certainly a lot more research needed. Nicola in London, thank you.